Hello friends, I am Dr. Chatterjee and today we are going to talk about frozen shoulder. Frozen shoulder, or as it is called adhesive capsulitis, it is the condition of the shoulder joint where there is too much stiffness of the shoulder joint. The symptoms include pain and also limited motion of the shoulder joint. What happens, the difference between this frozen shoulder and just rheumatism or pain in shoulder is that during if there is rheumatism of the shoulder joint, what occurs is that there is constant pain. That is, even if the shoulder is at rest, it can cause pain. But generally in frozen shoulder, what happens is that even if the patient tries to move the hand up or stretch the hand towards the side or go towards the back, these kind of motions are very much difficult for the patient itself. There are three parts or three stages of shoulder frozen shoulder. First one is the freezing shoulder. That is, the patient is able to move their shoulder joint with pain. The stiffness causes pain during the movement. The second part is frozen shoulder. In this stage, what happens is that the stiffness of the shoulder joint is increased to such a state that only a limited amount of motion of the shoulder joint is possible. And last stage is the thawing stage. Or in this stage, what happens is the stiffness of the shoulder joint decreases a little bit so that the patient can move their hand to a limited motion, but it is more than the previous stage. What are the causes of frozen shoulder? The causes of frozen shoulder are so much known, but mainly what happens, it occurs generally due to age, and it is seen that most people with frozen shoulder have a history of diabetes mellitus. Other causes also include surgery in the shoulder joint due to some fracture or even rotator cuff injury, due to which there is surgery, and after post surgery it might cause frozen shoulder in many patients. So what can we do? Along with homeopathic medicines which we can prescribe, what is needed for the patient to do is do certain exercises which can help a lot in this kind of cases. What are the exercises? Let's see. First exercise is called the pendulum exercise. Here the patient is set to stand and rest the other hand on the side of the table. And in this standing motion, basically the patient is extending and making the shoulder go free and move the arm in pendulum motion. This causes in many cases, stretching or these kind of exercises helps in relaxation of the joint and decreases the stiffness of the joint. The second exercise, where there is too much restricted motion or where the stiffness is very much high, what we can do is take the hand which has not take the side of the shoulder of the body which is not affected by this frozen shoulder, and take the hand by this of the affected side and assist the shoulder to make movements by stretching it. This also helps a lot in decreasing the stiffness of the shoulder joint. So after this exercise, so what more can we do? See, in cases of frozen shoulder, the best in cases of frozen shoulder, the best medicines we can think of is basically homeopathy. Before entering into homeopathic part of this video, let's also talk about some health supplements which can help in this kind of cases. Along with medicines, this can also help a lot. What are those? Number one is omega-3 fatty acids. If the patient who is having this complaint takes a little bit of omega-3 fatty acids in their diet or take it as a supplement itself, it helps in decreasing the inflammation of the joint and also promotes the development of the connective tissue in the area. Vitamin C, the second one. Vitamin C is found in most citrus fruits, lemons and everything. It is very much common in our diet. But still, a little bit of vitamin C supplementation from outside or taking it a little bit of more vitamin C in your diet, what it causes is that it helps in production of collagen, which helps in development of the connective tissue of the affected part. Along with that, another supplement which we can think of in this kind of cases is vitamin D. Now in today's lifestyle, what happens is that we don't get adequate amount of sunlight. So what vitamin D does is protects the bone. It looks after the bone and the connective tissue of this area, and also helps in reduction of the inflammation. So either we can do some exercises in the sunlight by going out for walks, or we can also think of vitamin D supplementation in this kind of cases. Other supplements which we can think of in these cases are one, curcumin, which is found in turmeric, which is a very active alkaloid. What it does is decreases the inflammation of the area, and along with that, it helps in promotion of building healthy tissue. Now, after this, what can we do? When the patient comes to our clinic, definitely we have to give them treatment. But before treating this case, we have to make sure that the patient knows that these kind of cases takes a good amount of time to recover. Even with health supplementation, exercises, and along the treatment, these kind of cases takes time to get better. So the person has to be patient while taking treatment of any kind. So moving on to the homeopathic part. Now, what are the homeopathic medicines which we can think about in frozen shoulder? Let's start with the specific. Homeopathy, as we know, that acts on individual patients in a way that all medicines need to be given in such a way, not just based on symptom similarity, but it would be better to give it in a constitutional form. Now, apart from constitutional medicines, what we can give to the patient, we can use these medicines in intercurrent form, or sometimes begin the treatment with this kind of medicines. What are those? Let's start. Number one, the very active medicine which we can think of in frozen shoulder is Asclepius tuberosa. Now, Asclepius tuberosa is almost specific for frozen shoulder. Now, we can easily read it in boric and the symptoms will appear on the screen. Other than that, the next almost specific medicine which we can think of in frozen shoulder is thiocinaminum. Now, thiocinaminum, as we know, is a very excellent medicine in dissolving scar tissue. So, in cases where the stiffness is due to some sort of tissue scarring, we can think of this medicine. And due to this tissue scarring itself, in most cases, the stiffness is coming. And in old age also, what happens is that the muscle loses its property of stretchability and becomes more towards rigid, and which causes this whole problem. Apart from thiocinaminum, few common medicines what we can think of are first Rustox. Definitely, Rustox is an excellent remedy of rheumatism and also has got a very good effect in stiffness as well. So, Rustox can be used in frozen shoulder, and especially when the person is stating that in also his frozen shoulder, if he does exercise, he is better by doing exercise, and after a certain amount of exercise, his stiffness decreases. So, there we can think of Rustox. Some other remedies which we can think of in frozen shoulder is one is arnica. Now, arnica is a medicine for injury, so it is not generally people don't think to give arnica in frozen shoulder. What arnica does is that it increases the blood supply to this area. So, if the blood supply increases to this area of inflammation, what it does is helps in the formation of new connective tissue, which in turn reduces the pain, reduces stiffness, and promotes better mobility of the joint. Now, other medicine what we can think of in this kind of cases, one again is Gettysburg water. Now, Gettysburg water is an excellent remedy of stiffness. Now, we can give Gettysburg water in stiffness of almost all joints, whether it may be cervical spondylosis, whether it may be osteoarthritis, or whether in osteoarthritis also where there is stiffness of the joint which is causing limited movement of the joint. In this case also we can think of Gettysburg water. Now, other medicine which we can think about in this case is not so much common in practice, but it would help a lot in this kind of cases. That medicine is Equisetum arvens. Now, Equisetum arvens is very an excellent remedy for where there is tear in tendon, ligament tear. It is a very excellent remedy for ligament tear. And in ligament tear, what happens is that there is excruciating pain. So, in this case also, basically frozen shoulder is occurring due to rigidity of the ligaments of the shoulder joint. So basically, and in many cases there is tremendous amount of pain in frozen shoulder. Most patients are taking some sort of analgesics or painkiller to get rid of the pain. So in this kind of cases where there is too much amount of pain, we can think of Equisetum arvens. And definitely after discussing this main medicines, two more medicines which we can think of, which is basically based on sides, is one Sanguinaria canadensis, sided involvement, and Ferrum metallicum for left-sided involvement. There is another medicine which we can think of in this kind of case, but it should be given only as a constitutional medicine, is Cifilinum. Now, Cifilinum is known for deltoid rheumatism of left hand, where the patient is only able to lift the hand to 90 degrees, cannot raise above that. So in this, if we can get this kind of symptoms along with other symptoms of Cifilinum, we can definitely prescribe Cifilinum in this kind of cases. What we need to think about while giving homeopathic medicine to this kind of cases is definitely we need to give some constitutional treatment to this patient, because these medicines definitely will help with the symptoms of this frozen shoulder, but at the same time it won't stop the recurrence of the same problem. The second point we need to understand is that this is occurring, most of the stiffness is occurring due to wear and tear of the joint. So in this kind of cases, in order to get a suitable result, we need to give a good amount of time to the patient and good amount of time to the medicine to heal this kind of problem. So with this note, let's meet again another time with a different topic, and for the time, thank you for watching this video.